everybody.
Good morning.
How's the food?
Good.
Great. Thank you.
Good. Next time I'll bring a little more. I want to introduce myself. My name is Pam Cowley. I'm the Community Outreach and Engagement Manager for the Vanderbilt Memory and Alzheimer's Center. And I'll tell you how I came to have this job. I wasn't really looking for work, but I had moved here to Nashville and I saw it. And Alzheimer's has had such an effect on my family. I just thought if outreach is what I do as a career, then this was an opportunity for me to do something in honor of my mother who passed away with Alzheimer's, and Aunt Rosie, her sister, also died with it. And then just a couple of years ago, I lost my one and only sister-in-law to Alzheimer's disease. So 3 really powerful and important women in my life. And I want to tell you guys a little bit more about the disease so you understand what it is, so you have an understanding of what the symptoms are, so if you see those in your family members, we can act on it quickly, because one of the issues for African Americans and Alzheimer's is that we tend to get a late diagnosis. So now that some new drugs are coming to the market, the sooner we can identify it, the better. So people have opportunity to make their own choices and have better quality of life with this condition while we're waiting to figure it out. And here's my colleague, Dr. Ray Romano, that can answer any clinical questions today, since I cannot. But my reason, of course, is just the passion behind my family members and wanting my community to do better and to have more information about this disease. There are things we can do to prevent it and reduce our risk, so we're going to talk about those today. Ray can answer questions about high blood pressure and other things that kind of increase our risk. But with that, we'll just go ahead and jump in. And Ray, when I need to refer to you, I'll call you in too. Yeah, you want to come a little closer because they're actually recording this today. But if you see on the slides here, you can see Ray brings the degrees. And then, of course, I'm a member of this community. So we work really well together in helping to spread these messages. These are the things that I just mentioned that we're going to talk about today. And then just want to do a quick introduction of our center. We are an entity of the Vanderbilt University Medical Center, but we're a freestanding research center. We're a nonprofit, and this is just a picture of some of the scientists that work on our team. We are trans-institutional, which means we work with other university research centers. Also, we partner with Meharry Medical College, and we have over 70 faculty members, 20 clinicians, which Ray is one of our lead clinicians, 41 scientists, just a huge number of people that are working to try to solve this problem. And the thing that we focused on most, of course, is better understanding risk factors, which we'll talk about a little bit today, resiliency, which is a person's ability to have Alzheimer's present in the brain, yet not have any symptoms. So some of the scientists at our center have actually identified that gene that causes some people to be resilient against the symptoms, which is amazing, and we certainly want to learn more about that. And then, of course, disparities, which we'll talk a little bit about why African Americans and other people of color are at higher risk for this disease. But first, we'll answer the first question that everybody always asks, is what's the difference between Alzheimer's and dementia? Can anybody answer that? Does anybody know what the answer to that question is? So we're all confused about it because people use the words interchangeably, right? Yes. Dropped my glasses, sorry about that. But dementia is just a general term for decline in memory, thinking, reasoning, functioning, and Alzheimer's is the most common form of dementia. So there are several different kinds of dementia. And as you see with the apples here, we have Alzheimer's, which they think is representative of about 80% of the cases. Then vascular dementia, which is connected to heart health. Lewy body, which is more genetic, right, Ray?
Yeah,
it tends to run in families. And then frontotemporal is another one that exists. But the majority of these dementias are found, the majority of cases are identified as Alzheimer's. So as I said, Alzheimer's is the most common form of dementia, making up the majority of the cases. And there is no single one cause. Of course, there isn't a cure, but the risk factors just include getting older, genetics, and then also lifestyle. So the largest precursor, of course, is age. So what do those changes in the brain look like? On the left side, or I guess, here's your left side, the healthy brain, you can see it's full, the tissue is touching, it's really close together. And then on the right side, you see what a brain looks like that has developed Alzheimer's. So as tissue dies, that brain will shrink, and you see it has gaps and things. So when you look at that, it's pretty easy to understand why a person that has Alzheimer's would have some issues with their thinking and memory, because you can see it's a huge difference between the healthy brain and that brain that's been affected by dementia. So when we think about the brain, we like to tell people to think of it like as a forest. When you think of a forest, it's full of trees and branches, and they're all growing and touching each other. The neurons, or the brain cells, or the nerve cells in your brain work the same way. They're signaling and talking to each other. And when Alzheimer's happens, it interrupts that flow of signals and information back and forth between the nerve cells. And on the right side, you'll see a photograph. That little brown image is what a healthy nerve cell looks like. And it has these tubes on it. So that one at the top that looks kind of like a corn cob, that's like a protective mechanism that's also on the nerves, on that nerve cell. And when it starts to fall apart or be attacked by proteins that are sticky, then that kind of gets in the way of those nerve cells working properly. Does that kind of make sense so far?
Yes, ma'am.
All right, good. So, Ray, do you want to explain the tau and amyloid presence in the brain?
Sure. So the two proteins that we know change with Alzheimer's disease are these amyloid proteins and tau proteins. So amyloid is a protein that is in your brain and typically gets removed, but in people's brains with Alzheimer's disease, the protein misfolds and it starts to clump together and forms this plaque that lives outside of the nerve cell. And then that plaque is outside the nerve cell. It's thought to disrupt what the cell is doing inside, and it leads to the tau to get dysregulated and become almost like spaghetti inside the cell. So it misforms and clumps together even more, and that leads to the death of the cells. So those are the two proteins that we check for, or we look at, or to talk about when we talk about Alzheimer's disease, is the amyloid and the tau protein.
Yeah, and like Grace said, those things are naturally present in the brain. It's when they become abnormal or overproduced, right, that they start to stick together and get in the way of those nerve cells communicating.
How did you check for this?
Great question. So currently, the way that we check for these two levels is through lumbar puncture and checking for in the cerebral spinal fluid. We also can do a PET imaging where we have these radioactive fluorescence, like a contrast that will attach to the proteins in the brain, and then we get a scan and then we can see what parts of the brain are lighting up. There's also research into blood-based markers, so we can measure those levels in your blood. That's in the newer phases of research, and that's really where everyone's pushing, is because people much rather give some blood than
Spinal
Yes.
tap. Yeah.
But the spinal fluid is like, I always say that it's like breast milk, because they call breast milk liquid gold. Spinal fluid is like liquid gold. So that same fluid that's in your spine also surrounds your brain. So it's one of the best ways that they have available right now, right, Ray,
Yes.
to identify those abnormal proteins in the early stages.
So how the lumbar puncture works is we go in the lower part of the back, well below the spinal cord. So the spinal cord runs down from your brain, down your back, stops pretty much almost midway, and then we go puncture a little bit lower than that. So it's well below, and then we remove some of the fluid that's around your brain. And that's how we check for those proteins.
I've done it.
Whole
so-
process, yeah,
Yes.
45 minutes.
Yeah, when we're done, if you want to ask me some questions.
Yeah,
then-
and go out, have breakfast afterwards, all that fun stuff.
Yeah.
I think there was a question.
Do they put you to sleep for this?
For a lumbar puncture, no, they don't put you to
Oh, no.
No. Usually we have you talk, we chat about the day, what you think you're gonna have for lunch. Yeah, we use lidocaine, so in a clinic, it'll be numb with lidocaine.
It's not quite the experience that people picture.
Yeah.
Yeah, you don't need to be put to sleep.
Lidocaine is usually the most painful part of it. It's that, if you ever had dental work, it's a stick and burn sensation, and after that, you're done.
What can you do
To prevent, that's a great question. I think we're gonna get into that. We're gonna talk about ways to slow or to prevent memory changes as you age.
One of the ways you prevent it is by coming here,
Yes.
because they know that isolation, can make people more susceptible. So being social, getting some exercise, just being with community is really good for our brain health. And this chart just kind of maps what those changes in the brain look like from preclinical, when it's present in the brain but the person hasn't had any symptoms yet. And then people start to have sort of mild problems, and then of course mild dementia. And I mentioned, Ray, just as we were getting started, that one of the issues for people of color is getting diagnosed in these earlier stages of the disease is so important, particularly now as new drugs and new therapies are coming to the market. And then most of us have had or seen folks in our community or in our families that have suffered with this disease. So it's most everybody a little bit familiar with what it looks like as it progressed. And it can go quickly or slowly. With my mom, it was 12 years from the time she got diagnosed until she passed away. And then with her sister, it went much faster, the decline. So there's still a whole lot to learn. Even though the past 20 years, and especially now, starting to see some of the fruits of research and the things that they're discovering. But I think it's also really important for us to understand what is normal, like for changes in the brain as we get older, and what is abnormal. So I'm going to talk about normal, Ray's going to tell you about abnormal. But it's normal to be more forgetful. Like, I have 6, 7 pairs of these because in no given time do I know where they are. So that's normal. Yeah, tip of the tongue, like having a word in your head, but you just can't. Yeah, that's normal. That's a normal change. Yeah. Because usually it'll come to you later. Even sometimes days later, it'll come to you. Right? And then same thing with forgetting names. That's common. I always say the nice thing about having gray hair is you get to call everybody baby. And that way you don't remember their names. You know their face, right?
What about when you're driving and you forget where you are?
That's in trouble.
I would say in a town like this that's constantly changing, it's not. I've only lived here 3 years. It's not that unusual for me to get confused about where I'm going.
I think if it's happening in a way that's every once in a while, right? Like you might randomly, you have 10 other things on your mind, you got groceries to pick up, and you might kind of be like, oh, I forget which way am I supposed to turn. Random once in a while. If it's becoming a consistent thing where you're noticing this is happening over and over again, especially around neighborhoods that you travel to frequently, it's always worth talking to your healthcare provider about, because that way we can ask more detailed questions to really get at, well, what's going on with you that might be causing you to experience this.
Yeah.
It could be because you've got a lot of stress going on, and if we work on stress, you never notice it again. But having that conversation is really important.
I was just going to say that, Rick. And then also just taking more time to learn new things, but you shouldn't lose your comprehensive knowledge. So there are things that you've enjoyed doing your whole life, a trade that you spent many years learning. You shouldn't forget like the full range of that knowledge that you have. That's not normal. And now, so Ray, I'm gonna let you continue on that topic of what would require a person to need to talk to their doctor.
Yeah, so things that might, you might perk your ears up if you're thinking about a loved one or yourself is changes in mood and personality. So sudden behaviors or acts that seem different from the person. So if they weren't a person, I use this example a lot, and all of a sudden they're cursing, that might be something to pique your ear about. If they are talking to strangers in a way that they are not picking up on social cues that, you know, this person doesn't really want to talk to me, a great thing to pay attention to. Challenges in planning or problem solving. Sometimes we see this if a person's going on a trip and they need to pack a bag, they're struggling to know exactly what to put in that bag. If they're going to cold weather and they're forgetting that they need a jacket or something, that might be a sign of something going on. Difficulty completing familiar tasks. So these are things where gardening is a great example. People love to garden, but they get out there and there's some confusion. Now, how do I get this garden bed? Like, what's my first step? Those are changes that we want to pay attention to. Confusion with time or place, like we talked about a little bit. So getting lost or confused going to very familiar areas consistently is a sign that we need to pay attention to. Confusion with time, this is hard for people who retire because it doesn't really matter much what day of the week it is always. But for the most part, a healthy adult should be able to use references and clues to figure out what day it is, plus or minus one. If a person is really off, that might be a sign. Also, keeping things chronologically, so time relationships. I know I lived here when I was 5 years ago, then I had this big family event, and then next year something else happened. Getting all that mixed up and confused about what came first is always a sign. Trouble understanding visual images and spatial relationships. We see this with particular types of dementia where there's confusion about how do I put on my clothes? I'm missing buttons. I can't always understand left-right directions. A person might be explaining to me to get the orange Gatorade, and they'll say, oh, it's by the plate, but my brain can't really process what that visual spatial information means, so I have to ask a lot of questions like, what do you want me to do? Where am I going? How do I do that? And then decreased or poor judgment is another thing that we pay attention to. Falling victim to scams, giving information to people that you know that you shouldn't be giving information to, or your loved one shouldn't be information to. Those are kind of things that we want to hear about in clinic, or I also want to hear about from my patients, because that helps me know what might be going on.
I'm not retired, and I don't know what day it is.
Me either, actually. I usually just show up to work and they just tell me where to go.
It's like, oh, there's other people here, good, yeah. But I think one of the most important messages here is that memory loss that disrupts your daily life is not normal. And I think to a large degree, we've come to think of it as something that just happens to people just because they've aged, and it's not normal. It shouldn't be happening to us that way. I'm going to let you talk about this one too, Ray.
So how do we diagnose Alzheimer's disease? So typically, I always encourage people to talk to your primary care. They know you. They know a little bit about your history, about what medicines you're on, what things have been going on. And they might do what's called a memory workup or refer you for a memory workup. And what a memory loss workup is really we're going to ask about your medical and family history. Do you have a family history of Lewy body disease? Because that can make us think, oh, maybe Lewy body is going on. Do other members of your family have Alzheimer's disease? Also, what medicines might you be on? What heart surgeries might you have? What reasons might there be for those memory changes? We also check blood work for your medical history. Vitamin deficiencies are a common thing that happen. Those are things that we can test. A key for a memory loss workup is having a family member present with you. So we love when people come with their spouses, their adult children, a good neighbor who sees them frequently, because they give us some insight in how people are functioning at home in their day-to-day life. So sometimes patients are like, I'm doing great, and when I talk to their wife, they're like, well, doing great, but I also need to go behind them after they do bills because they're making a lot of mistakes. I also have to explain directions to them multiple times while they're doing a task. So that family input is really necessary for us to really get the best picture. You'll do a lot of different memory and thinking activities with your provider. Sometimes if you're talking to just your primary care provider, they'll do a small test with you, which will test for global cognition, or they'll send you for a referral to see a neuropsychologist, where they'll do a full detailed workup with you, where you do a bunch of little memory and thinking activities, and that gives us some objective measure or some numbers around how your memory and thinking is doing. You're gonna ask a question.
What specific supplements would help?
That's a good question. So I don't recommend any specific supplements.
Vitamins.
Yeah. So and there's evidence to support that a general multivitamin is always good for your health. So most people could benefit from being on a multivitamin. Other than that, there's not the best evidence to support me telling you to be on a particular multivitamin. The best things that I can tell you to do are to keep your heart healthy, and like we've been talking about, staying engaged mentally and socially. That is where the evidence is. So exercising, eating a heart healthy diet, and being with community is some of the best things you can do to keep your memory and thinking in a good spot.
Yeah, because there's lots of marketers and businesses out there trying to capitalize off the fact that we're concerned about these things, but like Ray was saying, there's really not evidence behind some of the things that they're claiming.
So there's no evidence with the Reva or Prevagen or focus factor? I'm trying to think of, those things.
I said this a lot. I'd rather you spend money on your Y membership than spend money on those things. Because being here, exercising, being with community is probably much better for your memory than
Yeah, there's actually evidence
Yeah.
that that works.
Why do you let them advertise stuff like that? It ain't gonna help.
A lot of times there's the fine print at the bottom of the screen that we can't even see that explains that the Food and Drug Administration hasn't endorsed them. They usually get people that are doctors, who are usually paid spokespeople, right, to make those proclamations.
Well, actually, they don't help at all.
I can't say that they don't help. I just can't say that there's evidence behind it enough for me as a clinician to tell you that it's good for you. Placebo effects are real, but I can't say that there's enough that's worth it for you to take, but evidence behind it. I could tell you there's evidence behind exercise, there's evidence behind eating a heart healthy diet, and I know those will be helpful.
Is there a correlation between cholesterol and Alzheimer's?
That's a great question. So cholesterol tends to lead to plaque buildup in our arteries, and that plaque buildup can decrease blood flow to our brain, which can lead to changes in memory and thinking. So that's why keeping that heart healthy is really necessary.
Yeah, and that's at the center of our research that we're doing at our center, is heart health and brain health and how those two correlate.
Okay.
Any other questions for Ray?
What medications, prescription medications are used for Alzheimer's?
Good question. So the question was about prescription medications that are used to treat Alzheimer's. So there are a few drugs currently that are commonly used. Anticholinergic medicine, so like donepezil, is a common medicine that we start for people early in the disease.
Is that Kerosene?
Yep, exactly. And then later in the disease, we also prescribe a medicine called Namenda. Both work a little bit differently. So the one medicine, the donepezil, works in the cholinergic system, kind of helps keeps the memory and thinking functioning, and then the other medicine, the Menda, works to keep the brain cells healthier for a little bit longer. Neither of those are what's called disease modifying, meaning they're not changing what's happening to the disease. Yeah, they're not going to cure it. They hope to slow things down. The new medicine that just got approved by the FDA and is working its way through Medicare is called Leqembi, and that medicine is to remove the plaques that we talk about in people's brains. There's a whole process that's going to have to go, that needs to get figured out before those are going to be prescribed, but that's coming down the line, those new monoclonal, those antibody therapies.
What about inflammation? Inflammation? I mean, does that have a profound effect on? Okay.
Yeah, so the question was about inflammation. So we know inflammation is a sign of body dysregulation. So we measure in our site particularly a measure of global inflammation, and it seems that inflammation is associated with a disease burden. Now, is it a chicken and the egg? Is that the reason? Is it a side effect? But it's related. It's associated.
Okay.
Yeah. There's some questions back here.
What about high blood pressure medication?
Yeah. So blood pressure. I think we're.
Yeah, we got some slides on
Yeah.
some of this stuff, but, yeah, go ahead, Ray.
Blood pressure is one of the things that we can do well on, right? So we can take medicine that gets our blood pressure into a controlled spot. So there was this cool study that came out called the SPRINT study. So I don't know if you guys talked to your primary care provider. At one point there was a recommendation that we were going too strong, we were making people's blood pressures too controlled, that we could relax off a little bit. This new study came out called the SPRINT study, and it actually said, you know what, it's actually better for people's brain health if we get their blood pressure better controlled. And better control means your top number to be as close to 120 as possible, and that bottom number to be about 80. So taking your medicines to help bring that blood pressure down is going to help your brain.
Good medication management is really important, and also just remembering what's bad for your heart is also bad for your brain. It's just like a simple, and we know what's bad for our hearts, right? When I think about high blood pressure, Ray, I always try to think about it from the standpoint of your circulatory system, and that your brain needs to get blood and oxygen and nutrients up to it. And if your heart's not working well, or if your blood pressure's out of control, then it affects how well your brain receives those nutrients and oxygen.
Yeah, exactly. It's like a car too. I don't know if you worked on cars, right? If your motor's gunked up and the pressure's abnormal, your car's not going to function. The same with your body, right? If your arteries are clogged up, your blood's not flowing right, your engine's going to be not working well.
What kind of diet do y'all prescribe?
That's a good question. So I'm going to give you a correct answer, and then I'm going to give you what I tell my patients. So the MIND diet is one of the best studied diets that we have. Basically, it's a Mediterranean diet, a diet that's good in healthy fats, limits processed foods, and avoids a lot of red meats. Now, I tell patients, so that's the good answer. Now, what I tell patients is, whatever diet that's going to make you a little bit healthier every single day is the diet that you should be on, okay? So take what you can from that information, but if it's not realistic for you, don't worry about it. Take one small part of it, and if that's realistic, that is 10 times better than not doing anything at all. So if you eat one more apple a day, that's better than not eating an apple. One salad a day is better than never eating a salad. So those small changes add up, and over time they'll help you get to better health.
So isn't it healthier to get your blood pressure down, say with diet and exercise, than it is to just medicate it and be through with it, and that covers the overall picture.
Yeah.
If I'm wrong, yeah.
Yeah, so the question was, is it better to get our blood pressure down through diet and exercise than through medicine? Yes, right? First treatment for everyone should be diet and exercise, right? That should be the best. Now, we're human, it's hard to make change, and if we put in the effort and it's not really succeeding, getting on medicine is really valuable, because we know if I could bring your blood pressure closer to 120, your brain's gonna stay healthier. And that gives your body the time to keep up while you're doing all those things to get your behavior to change, while you're working on waking up to get to the gym, to exercise, or add those salads into your day. I tell my patients whenever I start a medicine, I always talk about how to get it off of your medicine, and how to get off of most medicines is by making some lifestyle changes, like eating better, exercising a little bit more, and things like that.
We've kind of already covered this, but I didn't talk about the fact that women are more likely to develop Alzheimer's than men. Would you talk a little bit about that, Ray, about why that is?
Yeah.
That's crazy.
I hear that every time I make that statement. Somebody says, the rest of them are driving.
So there's a little bit of us trying to figure that exactly out, right? We used to think that it's just because women tend to live longer that they're more likely to develop it, but we're actually learning a lot about things that are unique to women, right? Childbirth, menstruation. Those are things that women experience that men don't. And we're starting to learn that there are some sex differences that can contribute to, that likely are contributing to the reason why women are more prone to developing Alzheimer's disease later in life. I also believe that they're diagnosed later than men as well, which means that they're showing up later with more severe symptoms, and that's always sad.
So tell me what sex has to do with it.
So I mean, meaning not intercourse, but the hormones that make females and males different.
And lastly, on this slide, we would just like to reiterate that it's a really small percentage of people that develop Alzheimer's because of genetics. They have identified some genes that are present in folks that develop it, but most of the time when we see it in families, it's because we have similar health problems, similar lifestyle, similar diet that contribute to it. Yep. Anything else you would add to that?
Would you say that people with kidney failure are more prone to Alzheimer's because of the trash that is not able to be eliminated?
Yeah, I don't know if I can tell you. I don't know if I have a study behind this to confirm. But people with kidney failure. Yeah, I don't want to tell you misinformation, but I could look that up and we can reach out about it.
That's great.
Perfect.
Yeah, anything that we can answer, we'll get it back to Kalani and she can share it back with the group. Well, I feel like we've talked about almost all of these. These are what we know to be risk factors for Alzheimer's disease, and one of them is just getting older. So most people that present symptoms are usually 75 years old or older. But researchers also know that Alzheimer's is present in the brain long before people actually have symptoms. Yeah.
Yeah, I think almost a decade before people start showing symptoms, the proteins are building up in people's brains.
So do you recommend a certain age to try to determine if that is there before it starts showing up?
So the question, and correct me if I'm wrong, is about screening. Is there recommendations to screen for proteins that might be changing or for memory changes that might be occurring? So globally, across the country, there is no recommendation from the United States Preventive Task Force Service to screen for dementia in day-to-day life. There is a part of our Medicare physical, so once you turn 65, you're eligible for Medicare. If you have Medicare, as part of your Medicare benefit, you should have a comprehensive visit with your provider once a year. During that visit, they should do a memory and thinking activity with you that tests if you're having any changes in your memory. Those are what should happen. I tell people, if you're concerned, ask your provider, right? You have a little bit of being that self-advocate, and as our providers are getting better educated, people are going to take these things seriously and do the work to test you up. You have to be a self-advocate.
Yeah, absolutely, and I think we've heard very few people who are getting offered that screening, but it's covered 100% by Medicare for you to have a screening every year.
Well, I have a question. What would that screening look like?
It can vary, so that's part of it. So sometimes it could be, I'm gonna give you 3 words and I'm gonna ask you 5 minutes later. Sometimes it's, I want you to draw a clock and I'm gonna give you 3 words. Other times it's about a 15-minute paper and pencil thing. It's gonna vary by your provider. So asking them and asking them what tool they used, it's gonna be helpful because then we can know, okay, it seemed like they might not have administered this the best way or whatnot.
Is an EEG a part of that screening, or is that the second phase of the, like say for instance, if there are some abnormalities
Yeah.
in the initial screening, then you go to that?
Yes, so an EEG is specifically looking at brain
brain,
waves.
yes.
Yeah, well, we do a MRI, which is an image of the shape and structure of the brain. And that will tell us, determine, is there changes in the shape, or is it smaller than what we expect, things like that.
So are you saying you have to ask for an EEG?
No, I was asked for a memory screen
Yeah, with your annual every year.
with your annual.
Well, when I had mine, they gave me those 3 things to remember at the beginning. And at the end, they forgot to ask me about it. So I reminded them that you didn't ask me.
The one we do at the center is like pretty in depth, so I've done that. They'll ask you to remember a series of numbers and repeat the numbers in reverse, animals, young people would have a hard time with it, but it's meant to really challenge your memory.
You can do that with your primary care doctor.
Yes.
Yeah.
It don't be like that one time, but it's been a long time ago.
Yeah, you should be getting it every year if you're on Medicare.
They don't
Yeah, you have to ask.
You gotta remind them.
And that goes back to what we were saying about African Americans and other people of color getting diagnosed earlier is through those screenings. Yes, ma'am.
I noticed that you didn't, and you probably didn't need to necessarily, but I have noticed some of my friends who had COVID, they're having, I don't know if they know it, but I'm detecting that they're having some difficulty still now.
Yeah.
I don't know if you guys are in that study or not, but I'm just having to notice that if they're getting dementia, I'm kind of.
Yeah, there is a
concerned.
current study at Vanderbilt for long COVID
Okay.
because a lot of people start to notice memory problems and they think that's associated with the long COVID.
Yeah, and it's still just so early where we can't really say exactly for sure. We do know that COVID impacts memory, but to what extent, and is it makes other illnesses worse that are there, or is it its own separate thing? That's what we're still trying to figure out and getting more information on. But it definitely, from experience, it changes people a little bit, especially long COVID.
And also, Ray, I mean, I think I've read some things that say, like just the isolation that people experience, that they might have already been starting to have some symptoms, but the isolation that we all experienced to some degree during COVID might have, increased or made it progress faster.
Right.
Yeah.
Of course,
So-
I have one. I promise this
That's
is my
okay.
last one.
We love questions.
Is there any evidence that you may have that 10 years before it's diagnosed?
Can you re-ask that?
Okay. Is there any evidence that Alzheimer's is present or dementia is present in the body up to 10 years before it can be diagnosed, like cancer?
Yes. So,
Yeah,
so these plaques
Mhm.
and the tangles are the proteins that change in people's brains with Alzheimer's. We know that these proteins start to build up about 10 years before symptoms start. Now, right now, we don't actively test for these proteins in healthy adults. I can't say that that's going to change within the next 5 years or so. There's work to be done that's looking at these proteins in blood, in the CSF, but these are the proteins that we can start to detect changes, and that's through research that we can see these changes.
But you can see with the EEG.
It's not an EEG yet.
It's
It
an
wouldn't be
MRI.
an
I'm
EEG.
sorry, I
MRI,
said
yeah.
that.
It's with MRI.
An MRI wouldn't look at these proteins. The lumbar puncture looks at the proteins, and a PET image is where we attach these little radioactive things that fluoresce, and then we take a picture of your brain, and where those things fluoresce or bright up, those tell us where those proteins are.
and that's where that blood test, as it develops, is gonna be
Yes.
very handy
Yeah.
in
Earlier
diagnosing early.
diagnosis. Yeah.
Where
So that-
healthy people can be able to get tested for it.
Exactly, and that's where we're hoping, is we're gonna start thinking about this disease more like diabetes, where we can check and start to hopefully manage as we learn more about it and get people involved in research.
So it's the MRI, the PDT, and the blood or the spinal fluid.
Yeah.
That can tell if those are present.
Correct.
And for people that are having symptoms, they should, if the doctor doesn't recommend seeing a neurologist, you should ask for a referral to see a neurologist, because you really have to see a neurologist to get a proper diagnosis. Is that right, Ray? Where all of
That's-
those things have been
Yeah.
done?
That's a more complicated question.
Yeah.
So the question was, do we need a diagnosis from your neurologist? Your primary care provider can diagnose you. Primary care providers, though, have a lot to manage and have to know a little bit about a lot of different things. So it really can depend on your provider's comfort level, how often they see this, if they're gonna diagnose it. I completely agree with Pam. If you wanna see a neurologist, ask to see a neurologist, because they'll definitely be able to give you that diagnosis. Your primary care can, they just might not always be the most comfortable doing that.
And sometimes, like, there are other things that can cause memory problems, so you want to make sure that those are being ruled out as well, right?
Yes, yeah, so blood, like depression or thyroid dysfunction.
I have a question. You had mentioned something about drawing a clock. Yeah, my cousin was telling me that the doctor asked her to draw. What is it about drawing a clock?
Yeah, I laugh because our boss, she's a neuropsychologist, and I think she did her dissertation on a clock. So why we asked to draw a clock? It really makes your brain work, right? You have to plan out where the numbers get placed. You have to think through the way, or remember where hand placement should be. You have to be able to stop and process that information, because I'm going to tell you something and you're going to have to remember it so that you can put it out into paper. So it really is a good tool that we use to check on memory and thinking in a more global way.
Is everybody drawing a clock?
These are just some other risk factors, and I think we've touched on all of them a little bit already. Obesity, type 2 diabetes, history of depression, of course high blood pressure, smoking, excessive alcohol, and sedentary lifestyle.
I'm sorry, I was trying to sign this, I missed that clock whatever you're
Yeah.
talking about.
Can you say that again?
Yeah, so the clock, to draw a clock uses a lot of different parts of your memory and thinking, and that's why we ask, because it'll tell us a little bit globally how you might be doing. Yeah. And I think there was.
Does your center treat patients or you just basically do the research?
So Vanderbilt has a neurology department, and part of that department we see patients for cognitive complaints, and that's through the medical center. We're affiliated with the medical center, but we're the research side of the arm, and so our group, we do research. I see patients in clinic, but the majority of my time is spent in the research world.
So we're gonna talk about the things you can do, right? Because we want to reduce our risk as much as possible, because while people like Ray are working on solving this thing, we want to do our part to reduce our risk as much as we can. And one way is to just challenge your brain, maybe driving a different path to your destinations than I tend to go the same way every day, but it is helpful if you switch it up and challenge your brain even to that degree. During puzzles, those kinds of things, anything that kind of makes you step out of your comfort zone, and out of the repetitious things that we do is good for your brain. And then, of course, we already mentioned if it's good for your heart, it's good for your brain. So you want to take good care of your heart, maintain a healthy weight, and try as much as we can to eat a healthy diet. I know access to healthy fruits and vegetables isn't easy in all parts of this town. We hope that that certainly improves as time goes on. But coming here and the things that Ray mentioned, being social, getting a little exercise, not smoking, because there is some evidence that smokers, especially long-term smokers, have a higher incidence of Alzheimer's, and also not avoiding alcohol 100%, but also being moderate in the use of alcohol. And sleep is one that most people don't realize is really important. Ray, you mentioned it a little bit, that it's when the brain housekeeps and clears up some of that stuff that can create the sticky substances that get in the way of your nerve cells working properly. That when we're sleeping, the brain has time to kind of clear some of that stuff out. So it's important to get a good quality night's sleep, which means sleeping 6 to 7 hours a night. And then if you wake up in the middle of the night, that you're able to fairly easily fall back asleep. And if you're not sleeping well, you should definitely have a talk with your doctor, because sleep apnea is a really common problem that gets in the way of sleep.
On the sleep, is that night only, or if you a night worker and you sleep days, is there a difference?
That's a complicated question. Shift work and night work, we know, impacts our circadian rhythm, which is basically our body's natural alarm clock, go to sleep, wake up time. So it can impact. Now people can adapt, so having being a shift worker and adapting is expected, but we're talking about restorative restful sleep is really the big thing. So is your body getting enough of that restorative restful sleep? That's key.
We'll share it with Kiwani, but we just had a presentation, community presentation this week on sleep, and we'll share the link if anybody's interested in watching that.
Do that sleep have to be all in a row, like 6 straight hours? I don't never sleep like 6 straight hours.
Yeah,
I usually sleep
I don't
out.
either, but
I
it-
usually sleep out. I go home from exercise, I might get in the chair and sleep
Yeah.
about 3 hours. Then I might go to bed about 12, and then I'm up at 4.
yeah.
And I use
It's not
last
as-
2 hours, I
It's
got
not
sleep
as helpful
out.
as if you got it all at once,
But
right?
I always feel good, I got sleep out.
Good. It sounds like you're using your CPAP machine, which is important, because that is helping get that quality of sleep. Ideally, it would be all that together, but yeah, it's back to getting good sleep for you and what's useful for you.
Yeah. Everybody's a little different.
Yeah.
So resiliency, and I told you guys a little bit about this when we started, that Dr. Holman is actually doing research on this topic, and it's about people who can have Alzheimer's present in the brain, yet they don't seem to have any symptoms. So his team has actually identified that gene that they believe those people have, and that will take research on this disease a long way in figuring out why that's true for some people and not for others. So as research expands its knowledge, we are not just focused on treating the illness of Alzheimer's disease, but also ways to improve quality of life and also to prevent it in the first place. So there's lots of really important, exciting things happening in the research area. No questions? I love the questions. It makes us feel a lot better when people ask us a lot of questions.
But this says something researchers have identified genes that are most likely to provide protective factors.
Yeah,
So what are
that's
they?
a pretty new discovery. Do you know what the name of that gene is?
It's a complicated name. It's like it's like 10 digits long, and there's R's and S's and stuff in there.
Yeah, they haven't come up with the short, cute name for
Yeah.
it yet.
What we're learning about the disease is that it's a pretty complicated disease process, and that these genes are likely giving protection, but how, we're still have to figure out.
Yeah, but just discovering the genes is a huge discovery.
So would so could the common person have the genes, but maybe they're turned off or turned on, and maybe medication could turn these genes active? Are they dormant or
Sounds
not
like
functioning or?
a great research question. Yeah.
Good premise for study.
Yeah, you could help design some stuff with that later. But yeah, that's ideally what they're going to start to understand. Is if we can identify these genes, understand what they do, how can we make these genes do more of what they do, or turn off a little bit what they do, kind of depending on what's going on.
And what our director always says is that the brain is very complex. So long before there's a cure, what we really hope to do is to be able to treat Alzheimer's like we do high blood pressure and type 2 diabetes, because in a lot of cases, medication is the reason why people are living longer and healthier lives. So hopefully one day we'll get there where it's treatable.
Regulated through
Yeah.
medication.
Yeah.
So anybody putting more emphasis on determining why Black people would have it more, it's more prevalent in Black versus white, and why, I still have this question, Doctor, for you, why do, for blood pressure medicine, they give you something different than you would a Black person?
That's a great question. So I'll answer the blood pressure one.
And I'll talk about it.
Yeah. So blood pressure, so you're probably talking about amlodipine, which is a calcium channel blocker that we use in treatment of hypertension. And then for other adults, like white people or people who aren't identified with color, we use other medicines like lisinopril. Amlodipine, we know, is a medicine that is useful in people of color because of the way people of color process salt. There's a difference in the way salt is processed. So this medication actually is better for people of color because it works in that system and it helps lower blood pressure more effectively. So that's why a primary care provider might start you on amlodipine and might start me on lisinopril because it's going to work better in you, that amlodipine, than it might in you.
So that's the reason.
Yeah, it's the way salt is processed and the medicine works in that system.
So tell me then how it's all processed.
I don't know that exactly off the top of my head. That's a good question.
We'll have to bring Dr. Newhouse for that.
We'll have to bring in a hypertensive specialist to tell you that.
But I'll talk a little bit about just the health disparity part because I'm not a scientist, so I'm talking about this from perspective of love from my family and my community, that there hasn't been a lot of research on the effect of institutionalized racism on our prevalence of Alzheimer's disease, but we do know these things affect all of our health outcomes in general. And all of those risk factors that we showed you, those are more prevalent in people of color as well. So we are more prone and carry a heavier burden of high blood pressure and stress and environment and other things, not having access to quality health care, not having access to healthy food, that those things are more common in our community. And if those things attribute to heart disease, then, you know, you can see the line of the domino effect of all of these things that affect our lives. I believe that stress plays a part in it, and that we know that people of color don't live as long because to some degree the amount of stress that we experience societally. So there's lots of reasons for it. There are more researchers that are now kind of really looking at those more social kind of anecdotal aspects of things that affect health. And you'll hear it called sometimes social determinants of health. And there are many. And there are people that are becoming brave enough to really address those things and look at those as reasons. Because we don't, and especially before we go into the next part of the presentation, we don't want the community to believe that it's happening because of all the things that you do, because it's bigger than that, right? It's not our fault that our health outcomes are worse. It is many, many reasons why. And so we want to make sure that we talk about those as well. So any questions on that?
Right.
The blood pressure medicine,
Amlodipine,
not that one, the other.
lisinopril.
Yeah, now, we put on that, that's the cheap pill. And I swole up,
Yeah, that happens to black people.
and I didn't even look like it.
We can talk about it.
I'm sorry.
Yeah,
No,
so
don't
that's
apologize. We can talk about it.
So yeah, there is a reaction.
Raise comment.
Yeah, that is more common in people of color with that particular medicine, where there is facial swelling. So it's another reason why there might be differences in medicine. Now, I don't want to say that one medicine is better than the other. There's a lot of decision making that goes into starting someone on a medicine. What other medicines have you been on? What medicines are you currently on? What's your diet like? So just because your provider starts you on lisinopril doesn't mean they did the wrong thing. It's just that might have been the one that they made the decision for you. So a long answer to say that is a common reaction and another reason why we use amlodipine in people of color more often.
I use Berempomil.
Yeah. So that's another similar medicine that works really well for blood pressure.
We're going to skip through some of these slides just because you asked such amazing questions that a lot of these things we already talked about. And Ray told us a little bit about the new drug that's come out. And we've talked about the research that we're doing at Vanderbilt. And I just would say that a very small percentage of people of color participate in research, and that is how we know what the effects will be on some people. And our study, which Ray and I also mentioned, looks at changes in memory over time. So you would do those things that you saw on the slide that said the interview with you and your family and MRI, like pictures of your brain, pictures of your heart, and then we sit down with the participant and give them feedback on what we learned through all those assessments. And we also offer a support group for families that have a family member. And I think the thing that's really cool about the support group that we have is that we invite people that just received a diagnosis so they can talk to other people that have just received a diagnosis, because nobody knows what that's like other than people that are having that same experience. And family is invited to attend those sessions with them. And if you want more information about caregiver support groups to share with your family or neighbors that might be going through that, I do have some toolkits for churches Ray and I go out and do the actual memory test at churches. So we'll have an event, we'll bring some sandwiches and stuff like we did today, and the churches that we work with will do like a sign-up sheet, and then that way we know how many people that we're expecting to come. It takes about 15 to 16, 17 minutes. Ray would do the memory screen, and then you would have one of our other clinicians would talk with you about the test after to let you know how you did, what the score means, and then if you need to look into it further, they would make some recommendations for you. So we're at time, so we're gonna let you guys go. You've got the slides, our phone number and email address is on there. I've got cards and some booklets for you guys that are interested in having us come to your church.
Yeah.